Hi, and welcome back to Hill and Putnam's VA Disability Blog. I'm Natalia Joffrey, our first manager.
And I'm attorney Rachel Cheek.
So we've been talking about VA disability benefits, and I heard this term, Rachel, and I want you to enlighten us.
Absolutely.
What is DBQ and why is it important?
It's very important. So
Okay.
Great question.
Okay.
So DBQ stands for Disability Benefits Questionnaire.
Okay.
And this is a form that's used in evaluating any service-connected condition.
Okay.
So there are dozens of DBQ forms for each condition that you could possibly be service-connected for: diabetes, neuropathy, mental disorders, PTSD. Let's go ahead and use PTSD as an example.
Okay.
So what this form has is essentially all of the criteria that's needed for service connection or for a claim for an increased rating. It helps the VA get basically a quick picture of how severe the disability is and how the veteran's affected by it. There's a section where the examiner can note symptoms. They can note any kinds of specific sorts of symptoms. For PTSD, for example, there are all sorts of things that can show up. You can have sleep deprivation, you can have flashbacks, you can have suicidal ideation. There's a big number of things that can happen. And rather than having the examiner have to just kind of guess and keep in mind all of the possible symptoms that could be showing up, the DBQ form organizes them all in a way that allows the VA the rater to review and see exactly what's going on with the condition.
Okay. So who's completing the form? So is the patient completing the form before they go to the C&P exam, or is the examiner completing the form as they're completing the exam?
That's a good question. So actually, when we're talking about a DBQ form, that generally is something that the examiner is completing.
Okay.
They will have during the examination, they'll go through and they'll ask the veteran, they'll go through the entire list of questions and mark off as it's appropriate. Another thing that you can actually do, the DBQ forms are available online. And so it is something that your private doctor or your treating physician can fill out as well. It doesn't just have to be a C&P examiner. I know a lot of times veterans are treated with specific providers. Sometimes they don't have treatments, sometimes they do. If they do, it's always a good idea for them to have their treating provider fill out a form as well. Because if you think about it, the treating provider sees and has a relationship and understands, the veteran's specific history and their condition, whereas with an examiner, it's usually someone you're just meeting with for an hour. You've never met them before.
For the very first time, right.
Exactly. Yeah. And so sometimes you can get more detail from a provider who knows you and treats you, if that makes sense.
So in an instance like that, your physician could preemptively complete the form, and then that's the form that would be used at the C&P exam, or it would be a form in addition to the C&P examiners?
It would be in addition. So it would be added if you have your treating provider fill out that form. That will be added to your file, and that would be available for the examiner to review as they're reviewing your file prior to your examination. And it's just nice to let the VA have some extra information.
And that's something that the veteran can submit themselves, or that their physician would submit? How would you get that into the file?
You would, so they're available online, and actually I would suggest for anyone who has a C&P exam coming up, or maybe is wondering about the rating their condition should have, you can look that up yourself and kind of go through and see the symptoms that they'll ask. It's a good way to get prepared for a C&P exam as well.
That sounds really good, because sometimes I know even for us, when you go to your doctor's office, and they always give you that little questionnaire before you go in, it can be intimidating. Sometimes it's like you've got 5 minutes to fill this out and you're trying to remember, your family history or what problems you have, or sometimes you have issues that you don't even remember right in that moment. It's almost like getting it beforehand could be a little warm up.
Like a prompt.
Yeah, a prompt, exactly.
Yeah. And so I'm sorry to answer the first question that you asked. If you were having your provider fill out that form, you could print it out online. You can hand it to your provider and let them know, hey, I need this for my claim. Just answer the questions.
Right.
And once they get that back from the provider will sign it, give their credentials, and then the veteran will file it themselves. We'll send that into the VA.
Okay.
And that's the way that
You get
It's
it
put
in
to
the
the file.
file. That's great. Do you know which website they can go to download those forms?
I believe it's available through the VA's website.
The VA's website. Okay, great.
Yeah.
All right. Well, that's all we're going to discuss today. Please join us again in the future. But in the meantime, pardon me, if you have any questions, feel free to visit our website or call our office.
Thank you.